really want to get a sense of understanding of what's it really meant for trainees to have been involved in developing of the quality standards right from the beginning.
From my point of view, I think it's important that trainees have been listened to and heard by the college, and we've had a say in our training and action has been taken. I think that's a really refreshing, progressive point, and it makes me feel as though we do have a voice as a group of doctors.
So what do you think that these quality standards will actually mean in practice?
I think about this, and I think from a practical point of view, it will mean that amongst all the busy service pressures, the focus will be directed back to our education and training, and the educational value of our training won't be forgotten or prioritised for something else, and that in the midst of all service delivery, we will be trained excellently. And trainee surveys, as we mentioned, highlight this as a problem, that service delivery has become a focus, and I think that these criteria go a long way to making it clear that it's not acceptable for training to not be a focus of the two-year programme. The standards will also be in place across the whole of the United Kingdom, and therefore quality of training will be driven up everywhere, going some way to level the playing field so training isn't just a geographical lottery based on location and the particular work going on in your hospital.
How might it influence the perceptions of others coming into medicine, wanting to become a medical registrar, staying as a medical registrar?
Yeah, that's an important point, because there have been problems recruiting doctors into higher medical training. And I think if we improve the experience of core trainees and they enjoy their training experience, then we'll encourage doctors to stay within medicine. Having explicit standards will provide reassurance that education and training is a priority. Standards will also provide clarity of expectation, so we know what we're getting ourselves into. They also provide accountability, so we can't turn around and say we didn't know we were meant to learn this. And I think that improved quality of training will be reflected in improved quality of doctors, and no one can argue that they don't want to be a better doctor.
Okay, so finally, what's it felt like, do you think, for trainees to actually be involved in influencing change?
I think that being involved in any project as a trainee is empowering and inspiring, and hopefully the message to trainees is that you can be involved and change can occur under your own steam, and hopefully core trainees will be involved in similar projects and build on this in the future.